But what I would say is, what you need to do is, if you want to solve the paradox between it, as I said with central banking, you need central banking to reflect what is actually going on through the interaction of human economic activity using technology to get resources out of the ground and use them to their maximum utility. You're not at this point, with our technology as we have it now, going to know that level of what money's value really is in relation to currency. But if you have the central bank as a cooperative with all the citizens having a share, then they're going to regulate themselves, and they're only going to produce as much currency as is needed in the economy, and therefore you'll start to get a balancing of payments, not only within our system, but if other people adopt that system, and you have competition between the central banks, who each one being a cooperative of their own nation, you're going to start to see a better relationship between exports and imports between nations as they start to balance out. Hopefully, as the amount of currency throughout the world becomes more in harmony with what people are doing and the use of technology. Okay, so it's all about organisation, yeah. So you've got now a system where we solve the central banking system to some extent. It's not going to be perfect, but other people can fine tune it. Now we're going to look at the how to organise the healthcare system. If you have patient cooperatives, those would be patients, all the people who are on the books of a certain hospital in a certain region, or they would have a patient association. They would all buy a share, and there would be somehow a relationship between the shares that the doctors and nurses who own shares in the hospital own, and thus reflect the amount of work they put in, okay, to the patient's shares as well. And so with that, there would be no one outside the system who didn't have an interest in improving healthcare and improving the situation of patients and reducing waiting lists, so there were no waiting lists, through getting into the system. And it would also mean that there will be no surpluses or lack of resources put in, because it would be balanced out. Now you would still need a national health service that was free at the point of demand. So there would probably still be some taxation, because there might be gaps, for instance, if you're living in the Upper Hebrides and there's a population of about one person to every 20 miles, you might, even if you've got internet or something, a landline, if you're lucky enough to get that, you might not be covered for everything if it's an insurance scheme. Whereas what I'm trying to propose is that somebody's share means that they can get comprehensive medical treatment for anything that they need doing, anything that the hospital would be able to do. And of course, people don't just need to be part of one hospital's cooperative, they could be part of others, so that you get competition between the hospitals to produce the best care, and so also for the best specialist treatments. Like for instance, there is eye hospitals in London and heart hospitals and things which are well renowned. It's not just because they've got private healthcare available to people. It's because under our present system, you can opt into private care and you can still keep your national healthcare as well at the same time. So it's a flexible system. I would like to keep that and use that in a network of different cooperatives all working together, as well as cooperative firms in terms of throughout the economy, to make cooperatives the dominant model, because it's between a planned economy and a free market economy. You would have a social market economy, a true social market economy, because the people would own the market and it will be producing social goods. For instance, we have train companies now who are being weaned off subsidies from the government, but they're raising their fares above the rate of inflation to keep pace with the amount of currency that's being pumped in, not just from the Bank of England, but also probably from the Federal Reserve. They've been exporting money, about $14 trillion, which they were loaned from the European Union to stop them collapsing during the Lehman Brothers and housing bubble, which my other videos have covered on that subject. And the Americans are still not paid us back that money, so that's probably one of the reasons why, even though the European Union's about twice to 4 times the economic power of the United States, it's still made quite a dent. They will need to find a way to pay that money back to the Europeans and England. But there's nothing to say that if you have a free market system in the United States, that people who can't afford healthcare at the moment, they could make their own patient cooperatives, and therefore they would have their own sort of insurance, a surplus of money to provide healthcare, because not everyone's going to need healthcare at the same time. There's obviously going to be people who are in a quite deteriorated state. They might not have teeth or things like that because they've not had access to healthcare, or when they're ill they've just sort of powered their way through it. But if you can't have a system where you've got people who are so ultra healthy that they're obsessing about their healthcare all the time, and other people, a vast majority of people, somewhere in between, or the 60 million people in the United States who don't have any healthcare at all. So there are other problems to do with President Obama's system as well, which is a halfway house which feeds more money to the corporations and insurance companies, but by making everyone subject to that system. So that's imperfect. But you don't need to have something that's such a clean, elegant, perfect idea, but it's obviously unpractical. You've got to do things rationally by increments. You can't just leap forward. I mean, when men went to the moon, it didn't just happen. They didn't just go off. They planned it through incremental stages to get there. And America has a great tradition of organising big projects under the government as well as in corporations. Why the American citizens? There's no reason why you couldn't organise your own patient cooperatives, set it up. Then you'll float you're not only, there won't be any outside shareholders. All the shares, as the patient, as more and more patients join that cooperative, and the care gets better and better, and more people work for the cooperative, because obviously nurses and doctors are going to be patients as well. Then your share price is going to increase, your reputation is going to increase. It's a virtuous circle, yeah. And it will get rid of unobtainable surplus. Now, getting back to the central banking question, one of the main reasons that this idea developed of a central banking cooperative, from my perspective, was to deal with the problem of banks having favourable, in the fractional reserve banking system,